Hello, thank you for taking the time to view this presentation. I'm Melanie Knowles from the Early Year Service, and Geraldine Bruce will cover later slides. Geraldine is an infection control nurse from Public Health Hertfordshire. This presentation will inform you on effective infection control measures, the current COVID situation in early year settings in Hertfordshire, and update you regarding the current testing and vaccine position. Firstly, I would like to thank you on behalf of Hertfordshire County Council and families in Hertfordshire for the amazing work you've all been doing since March last year. It may not always feel like it, but you are truly appreciated. Up until the end of 2020, early year settings in Hertfordshire had only a small number of COVID positive infections. We saw a small rise in January, and now in mid-February, I am pleased to say that the numbers are starting to fall once more. The fact that the percentage of cases in early year settings, as identified on this slide, has been significantly less than in other settings is testament to all the hard work you and your staff are doing to protect each other and the children in your setting. Prioritisation for the vaccine is decided nationally, not by the local authority. However, we are regularly discussing with central government the importance of PVI providers and childminders receiving the vaccine as soon as possible. As you may know, the Early Year Service and Public Health in Hertfordshire are developing a pilot of home testing lateral flow tests. As we have such a large workforce over a large geographical area, this, as you can imagine, is challenging. We do not yet know when we will be in a position to roll this out across PVI providers in Hertfordshire, but we will update you in our regular emails.
Hi, aims and objectives of today's session are to provide an understanding of how COVID is affecting settings, how COVID is spread in your setting, how you can implement a system of controls to prevent the spread of COVID in your setting, safe use of personal protective equipment, how to report a positive case, and how Herts County Council Public Health team can support you. So how does COVID spread? Transmission of coronavirus mainly occurs via respiratory droplets generated during breathing, talking, coughing and sneezing. These droplets can directly infect the respiratory tracts of other people if they're within close contact. They also infect others indirectly. This happens when the droplets get onto contaminated surfaces, which are then touched and introduced into the mouth or eyes of an uninfected person. Incubation and infectious period. COVID-19 has up to a 14-day incubation period. This slide really demonstrates why self-isolation is important to protect others. Well, Sally was exposed to COVID-19. This is day 0. On day 5, Sally got a test for COVID, but the results came back negative. On day 8, thinking that she didn't have COVID, Sally is sent to school. She was contagious on this day and day 9, and these were 48 hours before any symptoms. On these days, day 8 and day 9, Sally exposed 17 people to COVID-19. Day 10, Sally becomes symptomatic and goes on to test positive. So what is meant by close contact? A contact is a person who has been close to someone who has tested positive for coronavirus with a PCR test. You can be a contact any time from 2 days before the person who tested positive developed their symptoms and up to 10 days after, as this is when they can pass the infection on to others. A close contact includes anyone who lives in the same household as someone with coronavirus symptoms or who has tested positive for coronavirus, anyone who's had any of the following types of contact with someone who has tested positive for coronavirus: face-to-face contact, including being coughed on or having a face-to-face conversation within 1 metre. Skin to skin physical contact for any length of time. Being within 1 metre for 1 minute or longer without face-to-face contact. Being within 2 metres of someone for more than 15 minutes, either as a one-off contact or added up together over the day, or having travelled in the same vehicle or plane as someone who's positive for coronavirus. Having a bubble system in your setting will really help to reduce the number of people who could be identified as a close contact. Bubbles work as a protective measure to help reduce potential transmission of COVID by keeping the same children and the same staff together. Establishing small bubbles will help in the management of any cases where a positive result has been identified within your provision, and may prevent a whole setting having to isolate and close. Consider how you can minimise mixing within your settings and keeping those groups apart as much as possible. Obviously, this is dependent on the size and layout of your setting. Care routines, including provision of meals, nappy changing and toileting, should be done within a space allocated to each bubble only. The use of communal outdoor spaces could be used by different bubbles at different times, for example, and equipment limited for each bubble to use, and if not possible, cleaned between use. So what does the guidance say? There is a lot of guidance out there. However, the following guidance will be used for this presentation, and the link is enclosed in this slide, which can be used afterwards. This particular guidance focuses on preventing and controlling infection, including the use of PPE in education, childcare and children's social care settings during COVID, and is fundamental in keeping you and your children you work with safe. In this guidance there is a range of protected measures, and these must be adopted to reduce the risk of transmission of the infection. These are often referred to as a system of controls. When implemented, creates an inherently safer system in which the risk of transmission of infection is substantially reduced. The 8 systems of control within the guidance are: 1. Minimise contact with individuals who are unwell. 2. Clean your hands thoroughly more often than usual. 3. Ensure good respiratory hygiene by promoting catch it, bin it, kill it. 4. Introduce enhanced cleaning, including cleaning frequently touched surfaces often, using standard products such as detergents and bleach. 5. Minimise contact between individuals and maintain distancing wherever possible. 6. Where necessary, wear PPE. 7. Where recommended, the use of face coverings. 8. Engage with the NHS test and trace process and respond rapidly to confirmed cases. Let's look at these in more detail. 1. Minimise contact with individuals who are unwell. If you have or are showing symptoms of coronavirus, at the moment that's a new continuous cough, a high temperature, or a loss of or change in your normal sense of taste or smell, or have someone in your household who is, you should not be in a childcare setting. You should be at home and seeking a test. When an individual develops coronavirus symptoms or has a positive test, ensure children, staff and other adults do not come into settings if they have coronavirus symptoms for at least 10 days. The 10 days starts the day after the start of their symptoms, or the test date if they didn't have any symptoms but had a positive test, whether this is a PCR or a lateral flow test. Anyone developing those symptoms during the day is to be sent home. These are essential actions to reduce the risk in settings and further drive down transmission of coronavirus. All settings must follow this process and ensure all staff are aware of it. 2. Clean your hands thoroughly more often than usual. Clean your hands more often than usual, particularly after arriving at your setting, when returning from your breaks, when changing rooms, and before and after eating or handling food, as well as after touching your face, blowing your nose, and sneezing or coughing. To clean your hands, you should wash your hands thoroughly for 20 seconds with running water and soap and dry them well. Or use alcohol hand rub or sanitizer, ensuring that all parts of the hands are covered. Take your time to wash your hands and follow these 6 steps to ensure they're done properly. First, palm to palm. 2, the backs of hands. 3, in between your fingers. 4, the backs of the fingers. 5, the thumbs. And 6, the tips of the fingers. Use a tissue to turn off the tap and remember to dry your hands thoroughly. Number 3, ensure good respiratory hygiene by promoting the catch it, bin it, kill it approach. Avoid touching your mouth, eyes and nose. Cover your mouth and nose with a disposable tissue when you cough or sneeze. If you don't have one to hand, sneeze into the crook of your elbow, not into your hands. Dispose of tissues into a disposable rubbish bag and immediately clean your hands with soap and water, as we demonstrated in the previous slide. Or, if there's no soap and water, use hand sanitizer. Number 4, introduce enhanced cleaning, including cleaning frequently touched surfaces often, using standard products such as detergents and bleach. Cleaning should be generally enhanced in your settings. It should be done more frequently, particularly with rooms that are shared and areas that are used by different groups. Cleaning frequently touched surfaces more often than normal, such as door handles, handrails, tabletops, play equipment, toys, not forgetting electronic devices such as phones. When cleaning, use just usual products like detergents and bleach. These are very effective at getting rid of the coronavirus on surfaces. Cleaning an area with normal household disinfectant after someone with suspected coronavirus has left will reduce the risk of passing the infection on to other people. The minimum PPE to be worn for cleaning an area after a person with symptoms of or confirmed coronavirus has left the setting is disposable gloves and an apron. Using a disposable cloth, first clean hard surfaces with warm soapy water. Then disinfect these surfaces with the cleaning products you would normally use, paying particular attention to the frequently touched areas and surfaces, such as bathrooms, grab rails, corridors, stairwells and door handles. If the area has been heavily contaminated, for example with visible bodily fluids, from a person suspected or positive of coronavirus, use protection for the eyes, mouth and nose, as well as wearing gloves and an apron. Wash your hands regularly with soap and water for 20 seconds after removing your gloves and aprons and other protective equipment that you wore during cleaning. Number 5, minimise contact between individuals and maintain distancing wherever possible. Where possible, staff should adhere to distancing guidelines as far as they are able to, but should also take account of children's emotional needs. Staff on shift should maintain a 2-metre distance from each other wherever possible, and this includes during your break times. If you suspect a child or member of staff in your setting may have COVID, PPE should be worn if a distance of 2 metres cannot be maintained. In some areas, this may mean that PPE is worn at all times until they've left the setting. Think of different ways of working. Have staff meetings and training virtually, avoid car sharing, and make sure that maximum occupancy is clear on rooms such as offices, bathrooms and staff rooms. 6. Where necessary, wear personal protective equipment. The majority of the time, staff in early years setting will not require PPE beyond what they would normally need for their work, even when you're not always able to maintain that distance of 2 metres from others. PPE is only needed in a very small number of cases. Children whose care routinely already involves the use of PPE due to their intimate care needs should continue to receive their care in the same way. PPE should be worn if a distance of 2 metres cannot be maintained from any child or member of staff displaying coronavirus symptoms. But remember, wearing a face mask may be scary for the child and they won't be able to see you smile. Explain why you're wearing a mask and consider the child's emotional needs. The safe putting on and taking off of PPE is vital to protect yourself, and we'll cover that next. There are a few important steps to think about before putting on your PPE. Make sure your hair is tied back and remove any sharp jewellery that could rip gloves. Make sure you've been to the toilet so you don't have to take your PPE off or wear it in the bathroom. The first step, the most important one, make sure your hands are clean before you touch your PPE, otherwise you'll just contaminate it before you even start. Number 2, put your apron on, making sure it's tied securely at the waist. Number 3, put your face mask on. Try avoiding touching the face mask and position it securely over your ears so that it's not dangling down your neck. Number 4, with both hands, make sure you mould the metal bar or strap to the bridge of your nose and pull the mask securely under your chin to make sure it's a good fit. Number 5, eye protection. You can decide if you need eye protection depending on what you're doing, as it's not always required. If there's a chance of bodily fluids such as a nosebleed or urine splashing you in the eyes, or the child is coughing heavily or spits, you might want to wear eye protection. Otherwise, it's not always needed. 6, put on your gloves, making sure they're the right fit. If they're too small, they could tear, and if they're too large, they won't do much and they'll just fall off. Taking off your personal protective equipment is really important and ensures that you don't self-contaminate yourself with coronavirus. There is a video link also attached with this presentation which gives a visual demonstration on how to do this correctly. Step 1 is to remove your gloves first because they're always the most contaminated. You must then wash your hands after you've removed your gloves for at least 20 seconds, following the steps we covered before. Step 3, to remove your apron. You'll see in the video attached that this is done very slowly and carefully. Don't be tempted to yank the apron off into the air aggressively, as you'll create a plume of coronavirus that falls down onto you and all your surfaces. Number 4, remove your eye protection. It's important to shut your eyes when doing this so that you don't poke yourself in the eye and self-contaminate yourself. Number 5, wash your hands again thoroughly. And then finally, step 6, remove your mask. Again, shutting your eyes so not to poke yourself in the eye. Last step, number 7, clean your hands thoroughly with soap and water. 7, where recommended, the use of face coverings. It's not mandatory for staff and visitors to wear face coverings in early years settings and childcare settings. In situations where social distancing between adults in settings is not possible, for example when moving around in corridors and communal areas, settings have the discretion to recommend the use of face coverings for adults on site. This is for both staff and visitors. Additional considerations: ventilation. Where possible and safe, windows should be open. In cold temperatures, maybe open the windows at various points through the day to ensure that there's some air circulating. Clear surfaces. Declutter all non-essential items from surface counters. Pack away toys into boxes so they're brought out only when required. Reorganise your space for staff in communal areas and create other usable spaces in your setting. Increase visual health promotion and reminders for staff to clean in between the use of shared items, particularly in the kitchen and staff room areas. Response to a suspected case. In the event of a child developing suspected COVID-19 symptoms whilst in the setting, they should be collected as soon as possible in line with NHS guidance. Whilst waiting for the child to be collected, they should be isolated from others in an identified room or area, if possible a window open for ventilation. The staff member responsible for the child in their bubble should stay with the child and consider wearing PPE. Finally, number 8, engage with NHS test and trace process and respond rapidly to confirmed cases. If you are contacted by test and trace and told to self-isolate, you must do so by law. Settings must take swift action when they become aware that someone who has attended their setting has tested positive for coronavirus. Settings must contact trace and ask all of the people who have been in close contact with the person who's tested positive to self-isolate for 10 days since they were last in close contact with that person when they were infectious. How Hertfordshire County Council can support you. We have a dedicated response team in place to support you. As soon as you're aware of a positive case in your setting, please email the address below. You'll then be contacted and you may be asked to start to gather information on a risk assessment form that we send you. You'll then be called back by an advisor. One of our team will call you back and complete the rest of the risk assessment. This will help you to determine who will need to self-isolate, discuss infection control advice and any other actions which are required. Our inbox is checked Monday to Friday, 8 AM to 9 PM, and Saturdays and Sundays, 9 AM to 7 PM. In some cases, an incident management team meeting might be called. These are useful to discuss complex cases or for large outbreaks. If requested by you, or in some cases, an infection prevention and control nurse can also come and visit your setting. These can be arranged by contacting the above address. That brings us to the end of the presentation. This final slide is a question and answer page. In advance, you kindly submitted some questions and we've answered them for you here. Of course, if you have any other questions, don't hesitate to contact the team. And thanks again for all you're doing.